Ibuprofen, brand named Motrin, has been prescribed for your pain. Ibuprofen is a non-steroidal anti-inflammatory drug, also known as an NSAID. Ibuprofen lowers inflammation, reduces pain, and lowers fever. According to Pharmacology for Nurses, a pathophysiological approach, OACH by Michael Adams, ibuprofen works by inhibiting COX-1 and COX-2 to inhibit prostaglandin synthesis.
According to Davis's Drug Guide for Nurses, Valerind Sanowski with Dechlin, ibuprofen's indication would be treatment of mild, moderate pain, fever, inflammatory disorders like rheumatoid arthritis and dysmenorrhea. Ibuprofen treat severe pain with opioids. Contraindications are hypersensitivity, active GI bleed, or ulcer disease. Chewable tablets contain aspartame, should not be used in patients with phenylketonuria, coronary artery bypass graft surgery, history of recent myocardial infarction, severe heart failure. Adverse effects are headache, constipation, dyspepsia, nausea, vomiting, Stevens-Johnson syndrome, GI bleed, hepatitis, and heart failure.
According to the Davis Drug Guide for Nurses by Valerind Sanowski and Dechlin, interactions for drug-to-drug may limit the cardioprotective effects of low-dose aspirin. Concurrent with use with aspirin may decrease effectiveness of ibuprofen. Additive adverse GI side effects with aspirin, oral potassium, other NSAIDs, corticosteroids, or alcohol. Chronic use with acetaminophen may increase risk of adverse renal reactions, may decrease effectiveness of diuretics, ACE inhibitors, or other antihypertensives. Assessments would include assessing for pain, assess patient for skin rash frequently during therapy, discontinue ibuprofen. First sign of rash may be life-threatening. Stevens-Johnson syndrome or toxic epidermal necrolysis may develop. Assess for signs and symptoms of GI bleeding, tarry stools, lightheadedness, hypotension, renal dysfunction, elevated BUN and creatine levels, decreased urine output, and hepatic impairment. Teaching. Advise patients to take ibuprofen with a full glass of water and to remain in an upright position for 15 to 30 minutes after administration. Instruct patient to take medication as directed and to not double dose. It may cause drowsiness or dizziness. Caution patient that use of ibuprofen with 3 or more glasses of alcohol per day may increase the risk of GI bleeding.